Congressman, thank you for being here. Your first question is going to come from the audience, and this gentleman right in front of you.
My name is Tom Carroll. As a retired Sioux City pathologist and medical examiner, I know that comprehensive access to health care is vital for people with serious medical issues. Lawmakers say they want to protect patients with pre-existing conditions, but many of the proposed plans have financial caps or don't cover medical services or drugs needed by these patients. Cancer patients and survivors cannot go back to the days of the ACA, when insurers would not pay above a certain amount or charged outrageous premiums that were many times higher than a healthy person would pay. What would you do to make your people with existing conditions, like cancer, will have access to the coverage they need at a price that they can afford?
Thanks for the question. I'm going to sign the law, Medicare for America. This is going to guarantee universal, high-quality coverage and care for every single American without exception. Those who are currently uninsured and uncared for are going to be able to enroll in Medicare immediately. Those who, as you referred to, are insufficiently covered, cannot meet that copay, afford the premium, or bridge the deductible, they're also able to elect to move into Medicare. But for those who have private employer-sponsored insurance, or members of unions who have fought for health care plans, sometimes in lieu of wage increases or other earned benefits, and have a health care plan that they like because it works for them and their families, they'll be able to keep that. So we get to universal guaranteed care while still preserving choice, and we avoid the false choice between the status quo, what we have today, the Affordable Care Act, and something that would force tens of millions of Americans off of private insurance and towards Medicare. And the out-of-pocket costs are going to be capped at no more than $5,000 for every American. Lower income and middle income Americans will pay nothing in most instances. No deductibles for any American, including on employer-sponsored and private insurance. So we make this far more affordable and ensure that far more of our fellow Americans can be well enough to live to their full potential. Thanks for asking the question. Appreciate it.
At one point in 2018, you seemed to be advocating for a single-payer healthcare system, but now you're talking about more of an evolution of people being able to transition from their private insurance. Have you actually changed your position, or has this just been an evolving plan? How does it work?
Yeah. The goal has always been guaranteed high-quality universal health care. That means you can afford your prescription medications, you can go to see a primary care provider. Mental health care is delivered by a world-class provider or an outpatient facility, not, as is the case in Iowa and in Texas far too often, in a county jail or out on the streets. Every woman able to make her own decisions about her own body and having access to the care to make that possible. But as I just said in my answer to the last question, really important that as we get to guaranteed high-quality universal, that we also preserve choice. And that's something that I'm hearing loud and clear from our fellow Americans. Here in Iowa, listening to Dee Taylor and the culinary workers in Nevada who said, my members fought for the health care plans that they have. They don't want to enroll in Medicare. They want to keep what's working for them right now. So this is a reflection of what I'm hearing as I listen to people across this country, and it is the best way for us to get to that guaranteed, universal, high-quality care for every American.
And you mentioned mental health care. So how do you cover that under your plan? And is Medicaid continue to be a part of that? Or is it something, an entirely new type of benefit?
Mental health care is now going to be delivered through Medicare, and it is guaranteed without exception. Someone at a town hall not too long ago here in Iowa told me that this state ranks 51st in access to mental health care. I mentioned my home state of Texas. The largest inpatient mental health care facility is the Harris County Jail, and it costs us $110 a night to keep someone and their potential locked up, someone who may have gotten arrested on purpose to go to the one place that they're guaranteed to have coverage and care for their schizophrenia or their bipolar disorder or their clinical depression. We remove that kind of cruelty and that uncertainty from our fellow Americans by guaranteeing them care under Medicare or ensuring that if they have employer-sponsored insurance, that is guaranteed as well.
Let's discuss the solvency of Social Security and Social Security benefits. When you were in Congress, you co-sponsored a bill that would change the cost of living calculation. Explain.
Yeah. I want to make sure at a time that most seniors are seeing a Social Security earned benefit at somewhere under $18,000 a year, that they can afford their retirement. That was the original idea behind Social Security in the first place. So the Social Security 2100 Act that I co-sponsored while I was in Congress increases the earned benefit that is paid out. I believe it begins with a 2% increase immediately, and then it is adjusted to the true cost of inflation for seniors, reflecting what seniors are purchasing and spending money on as distinct from perhaps the general public. We fund this by making sure that every American, including the wealthiest, are truly paying their fair share. As we all know now, every dollar, every $1 million, every $1 billion that you earn over $133,000 is not taxed into the Social Security Trust Fund. By lifting that arbitrary cap and ensuring that the highest earners and the wealthiest Americans are paying their fair share, we can afford this, and we can also guarantee the solvency of this incredibly important Social Security safety net well into the next century.
Americans are living longer. Should the retirement age be ratcheted up?
No.
Why not?
This country has more than enough resources to fulfill our obligation to every American who every working day of her life has paid in to that program. As I just suggested, if we lift what is an arbitrary cap right now, we have the resources well into the next century, and we can actually pay a much more generous earned benefit to those who have paid in. So no need to raise that age.
We've heard a lot of proposals this week about how to help people pay for their prescription medication. One of them that we heard today was to actually have the government manufacture generic medication if companies won't lower the price. Is that a good idea?
You know, it may be an option that we look at and leverage to use to try to get drug manufacturers to bring down the cost of medications. This is something that's incredibly insulting to most Americans that I listen to. They remind me that as taxpayers, we paid for the initial research and development to many of the cures and medications that are subsequently sold back to us at some of the most expensive prices on the face of the planet today. We inexplicably do not use the leverage of Medicare and its purchasing power to bring down the price. That's something that will change in our administration to make prescription drugs affordable for every American. We'll also allow you to buy from Canada, the European Union, Japan, other countries that have high standards for their testing of medications, but sell at much lower prices that we're seeing here today. And yes, we need an FTC that will vigorously enforce against this monopolistic practice of generic drug manufacturers who are selling life-saving medications back to our fellow Americans at prices that far too many of them cannot afford, to the point that they're doing without and dying prematurely, or crowdsourcing the funding for medications in the wealthiest, the most powerful country on the face of the planet, the same country that came up with these medications so often in the first place.
Do you think that pharmaceutical companies, easy for me to say, are just really spinning people when they say that these kinds of measures will really eliminate their ability to research and bring into development life-saving medication like for Alzheimer's or for cancer?
You ask if they're spinning us. They absolutely are. And
how do you know? How do you know that, though?
Because what we're seeing in the United States is not found in any other country. The fact that 97 years after the development of insulin, you have people dying of diabetes in the United States of America is unconscionable and inexplicable unless you follow the money and these pharmaceutical corporations' ability to buy not just access to members of Congress, not just influence, but outcomes along the lines of what we're describing today, to also be able to purchase almost, well, functionally complete impunity. I think of Purdue Pharma, who has helped to market these opioids that have consumed the lives of tens of thousands of our fellow Americans. And though we have the largest prison population on the face of the planet. A lot of people there serving time for marijuana arrests. More likely than not, people of color, though all Americans use marijuana at the same rate. No one from Purdue Pharma has spent a night in jail or paid a meaningful price for what they have done to this country. So when we hold pharmaceutical companies, manufacturers, and marketers accountable, it brings down the price of medications. We also get improved outcomes, and corporations who live and work in line with our values in this country. They are completely out of line today.
You mentioned marijuana. Do you envision it becoming a prescription medication that you go to the corner pharmacy and obtain? Do you think there should be uniform standards, or do you think the state-by-state sort of hodgepodge should continue?
We had this town hall meeting in Waco, Texas, not too long ago, and young people had hosted it, and they had asked all the questions. No one asked this one. But afterwards, in the photo line, an older couple came up to me, senior citizens, and this woman said, "Can I ask you a question?" I said, "Sure." And she said, "I want to ask you about marijuana." And she was really nervous and almost embarrassed and ashamed to talk about it. I said, "Well, of course, ask me about this. And I'm sorry you didn't want to ask in front of everyone else." And she said, "I suffer from fibromyalgia." And she said, "Every waking moment of life is close to unbearable. I have short-term memory loss. I cannot sleep. I've taken every prescription drug under the sun, and nothing worked until someone introduced me to marijuana or cannabis." And she said, "It's the only thing that makes life worth living." And yet in Texas, she told me, she's a criminal in the eyes of the law. So yes, let's end the prohibition on marijuana. Let's allow that woman or a veteran coming back from serving this country with post-traumatic stress disorder who does not want to be prescribed an opioid to use something to which they will not become addicted, from which they cannot die through an overdose, which will improve their quality of life. And no, let's not wait for a state-by-state decision. Let's do this on a federal basis now. End that prohibition once and forever.
One of the costs of getting older is the cost of long-term care, and people often have not saved for that after they have taken care of their kids. They may have their kids move back in with them after college or couldn't find a job. And so it creates an enormous amount of pressure and stress. People turn to maybe financial instruments that don't have a good return. Do you consider the cost of long-term care in your Medicare for America plan? And if so, how does that work?
Yeah. Yes, is the short answer. And what you describe, I'm hearing from so many people across this country, folks who file for divorce or run their finances down until they're in poverty or bankruptcy in order to be eligible for Medicaid-sponsored long-term care. No one should have to do that, and so we include it in our Medicare for America proposal, ensuring that you're not governed by a cap or by your finances or by your zip code on a state-by-state basis, but this is something that is guaranteed to every single American as they get older. Also making sure that we invest in your ability to age in place, to not be institutionalized, to make sure that we double the amount of money that the federal government is spending so that you can improve your home, so that you can stay there over the course of your life at really what is going to be a fraction of the cost if you were institutionalized, and at a much better quality of life for you. And then in addition, we're going to do the following. We're going to change Social Security so that if you are one of those caregivers for an aging parent or relative or for your child, you are not penalized, and we count the quarters that you provide that care for a family member towards your retirement. This resolves an imbalance that disproportionately hurts women in this country, and I think it's the right way to go.
Broadband access is problematic for many Americans, and even those who can access high-speed broadband can't afford the fees. How do you address that?
We need to partner with those communities, especially in rural America. I'll give you an example. Half of rural Texas cannot get online reliably. So if you're a farmer, try getting your goods to market, try finishing your education, try looking for a job or starting a business or finding a date on Tinder if you cannot connect to the internet. Close to impossible. And so we need to partner with rural America, show up, and make sure that we do the right thing. And I remember talking about this in a small rural community. And before I could finish what I was saying, a gentleman stood up and he said, I was in first grade in 1937, and our community did not have electricity. And I remember that President Franklin Delano Roosevelt, and this was in Texas, Congressman Lyndon Baines Johnson, partnered with our community through the Rural Electrification Administration, lit our community up. I could read by electric light, just like the kids in Chicago or London or Tokyo. Our community mattered. And he said, Beto, you better believe my daddy was a yellow dog Democrat every day afterwards. When we show up and invest in broadband internet in those communities who are not able to get online today, their competitiveness, their ability to perform, their contribution to the greatness of this country, our economy, and their community is going to be unstoppable. So it's an investment well worth making.
When people have access to the internet, people who may wish them ill have access to them, right? You have a disproportionate number of seniors who fall victim to phone scams and internet scams. And beyond education and awareness, what could you do as president to bring more of these perpetrators to justice?
We have to ask more of and ensure that it's backed up with enforcement. Our internet service providers and the social media platforms upon which we spend so much of our life today. In this day and age, all of us, the people of this country, have become the products online. We're being bought and sold, traded, our personal information, our pictures, our likes, and our dislikes. I think we need a robust set of regulations that are vigorously enforced to make sure that your privacy is protected. And those who commit fraud against seniors or against any American are brought to justice. Without having that kind of accountability and that kind of enforcement, you're going to continue to see these kinds of practices. And these companies are making record amounts of money right now. We can certainly ask them to make that investment in our privacy, in our security, in our safety, and we can back that up with the Department of Justice that will make sure that they are following the law.
Federal data indicates that 20% of Americans who are 65 or older are either actively working or they are actively seeking a job. Should Social Security rejigger the system so that you're not penalized if you work too many hours, you lose benefits?
So it's a great question. The short answer to this is yes. We see so many people right now who are making decisions that are otherwise against their self-interests in order to be able to qualify for earned benefits or just to be able to make ends meet. In answer to your question earlier about long-term care, I talked about Americans we've listened to who've had to file for divorce. I just met a man this morning in Iowa who is not working right now. He's 60 years old, so that he can qualify for Medicaid. Just found out that he had pancreatic cancer, was not given time off from the job that he had before to be able to get in front of a doctor and get the care and the help that he needed. He wants to be working right now, but he's penalized for doing that. By that same token, if you still have more to contribute and to offer, I want to make sure that you can do that while still being able to contribute towards the earned Social Security benefit that you'll be able to rely on later in life.
Some candidates in the race have floated the idea of a universal basic income, and they have various names for it and various ways that they would administer it. Is that a good idea?
No. I understand where it's coming from. Again, we're describing so many ways in which so many Americans are struggling to get by right now. But an automatic payout to every American that would cost this country trillions of dollars is not the answer. A minimum wage that is a living wage, $15 an hour as a minimum, is a great place to start. Ensuring that labor is able to organize, a right that was withdrawn from public sector employees here in Iowa in 2017. Let's make sure that school teachers and public educators can advocate for their and the children who are in front of them's best interests be paid a living wage so they don't have to work a second or a third job. Let's also make sure that every single American can afford a higher education if that's what they want to pursue, or are able to join a union and enter an apprenticeship to learn a skill or a trade to connect with the millions of jobs that we are creating in this country right now that we cannot fill. High wage, high skill, high value jobs like those renewable energy technology jobs that we're going to need to have more of if we're going to wean ourselves from a dependence on fossil fuel and combat climate change before it's too late. So there are ways to meet this challenge. I don't think a universal basic income is the right path.
How do you meet the challenge of ensuring Americans who believe they've been discriminated against because of their age at their workplace are able to pursue legal action against their employer? Because as we've discussed before you got to the stage, there's been legal action that has made it harder to prove.
Yeah, and we're seeing this across the board in this country. No one ever would have thought that the Americans with Disabilities Act would begin to be rolled back piecemeal, as it is right now, putting the onus on that American with a disability instead of the business owner to make sure that she or he is compliant. By that same token, if you're discriminated against in the workplace based on your age or your gender or any other difference that should not matter in the workplace, we need to make sure that the burden is not on you, but the employer to rectify that situation. And it's true for age discrimination. It's true, we know, based on race. We know that women in this country, on average, are paid 80 cents on the dollar that a man makes. Latinas, 53 cents on the dollar that a man makes. So we need to take action on this and make sure that the help from the federal government is in behalf of the worker and not the corporation. Part of that imbalance that we talked about when we were talking about pharmaceuticals as well, one of the ways that we get there is to ensure that we elevate the power of people and diminish the power of corporations. This campaign does not take a single dime from a single PAC or corporation or special interest. We should forbid federal candidates or federal office holders from being able to take money from corporations or special interests or political action committees. Then I think the focus returns to people and ending this kind of discrimination, and then also making sure that we stop discrimination for people who today are not protected. In some states, mine included, you can be fired based on your sexual orientation. You can be denied the ability to adopt based on your sexual orientation. That should be protected as well. As president, I'll sign into law the Equality Act, which will protect against that kind of discrimination.
What about our veterans who were promised health care for life, but often through the VA system have been failed by a long waiting list, by a real difficulty in keeping the workforce up to where it needs to be? What do you do about the VA?
I was knocking on doors when I was first running for Congress, and this was January of 2012, and a veteran who answered his door said, "Look, Beto, if you really want to help, do something about this. I just got off the phone with the VA trying to make an appointment with a mental health care provider to treat the PTSD that I've been carrying since I returned from Vietnam. And the VA told me to call back next year. They had no more open mental health care appointments for calendar year 2012. I thought the guy was pulling my leg, trying to make a point. I since learned that El Paso had the worst wait times to see a mental health care provider in the country. Care delayed became care denied, was connected to the fact that we're losing veterans at a rate of around 20 to 22 a day, every single day in this country. So in El Paso, we turned the El Paso VA around by ensuring that we hired more mental health care providers. We also nationally applied those lessons learned by expanding access to mental health care. But today, there are 40,000 funded, unfilled positions at the VA. We've got to fill them to make sure that every single veteran waiting for care is able to get them. I want to do that in part by vigorously expanding the public service debt forgiveness program. If you have tens or even hundreds of thousands of dollars in student loan debt and are willing to serve one of those brave service members who put their life on the line for this country. I want to wipe clean your debt so that you take one of those positions, reduce the wait times, improve the care and the outcomes. I think that's the way that we serve our veterans. That's what I'm going to do in my administration.
Okay. Thank you for answering our questions. I'm going to give you just 30 seconds to wrap up if you'd like.
Thank you. Thank you all for having me here today. Thank you for the questions. Look, I'm here and I'm running for president because I believe in this country. I believe in America. When I met that gentleman that I referred to earlier today, James, who's 60 years old, has pancreatic cancer, is at wit's end as to how he's going to be able to take care of himself, I've got to believe that we can be there for him, that the wealthiest, the most powerful country on the face of the planet has the ingenuity, the innovation, the political will to bring the answers to bear for the greatest set of challenges that we've ever faced. Healthcare for every single American, an economy that includes all, being there for those veterans who put their lives on the line for this country, confronting climate change before it is too late, and doing this not as Democrats, not as Republicans, but as Americans first before we are anything else. Let's get out there and do it. Thank you all for having us out. Gracias.
Thank you so much.
Appreciate it.
Thank you.